Hi everyone, Dr. Nemechek here with another edition of Viewers Questions Answered. So we've got some questions from the last week I want to go over, and just quick reminder, hit subscribe so you can stay abreast of what's going on, and that'll move us up in the rankings so other parents, especially parents with kids with autism, can find us more easily. First is a question from Jack. He says, you mentioned that gut motility is controlled both by the autonomic and enteric nervous systems. Does the enteric nervous system get routinely damaged, and if so, can it be healed through the protocol? So actually, the autonomic nervous system has three branches: sympathetic, parasympathetic, and the third is the enteric nervous system. So it is actually part of the autonomic nervous system. It's often called the second brain, the enteric nervous system, because our brain up here has about 50 billion neurons, and the enteric nervous system actually has 500 million neurons. So it is organized very, very similarly to what you see in the brain. And it seems to be damaged by a variety of things. It's hard to know for sure, but certainly symptom-wise, it looks that way. Because when it is not working correctly, you get things like slow motility, which gives you heartburn, reflux, cramping, and constipation. So we'll see that a lot. And on a practical level, when we're using our protocol, and again, the protocol's focus is simply to lower inflammation throughout the body and allow some natural repair mechanisms to take over, that the intestinal symptoms that are attributed to enteric nervous system function, which aren't working correctly, we'll see those normalize. So I think it does repair. At least on a practical level, it's functioning good enough that, it becomes almost an academic question then. Got another question here from Anne. She received a concussion from her tailgate on her van 4 days ago. That's kind of what I had. Just the other, except for mine was the hatch on my expedition. Got a bad concussion. What can I be taking now to help with the healing process at this point? So, if everything's fine, if you're healthy, the healing process is all you need, and it will take care of itself. Certainly, you want to rest to a certain degree. You want to avoid toxins like, say, alcohol while you're going through this healing process. But things that can help are to lower inflammation, and things that can do that rather quickly are the 2 tablespoons of olive oil. That helps lower inflammation by blocking the inflammatory component of these high omega-6 seed oils in the food supply, as well as a pretty high dose of the omega-3 DHA. Now we have our Nemechek silver capsules, or you get DHA 500 from Now Foods. Both are very high amounts, because DHA is the only omega-3 that gets in the brain. I think those are really the key thing. If your recovery is kind of slow and you may have a history or you develop some intestinal symptoms, you may want to get around a 10-day round of rifaximin to help balance your intestinal bacteria. Anyhow, good luck, Ann. Another question from Vic. We've been doing the protocol for 4 months now with positive improvements. I'm assuming it's with the way they wrote this with their child. Should we increase the dose now? Nope. You don't. Whatever you're using to balance the intestinal tract, if you're an adult and it's rifaximin or inulin, or kids, if it's inulin, you don't change that at all. You just sit tight. Now, the fish oil and olive oil will change in children, but really, if you're following the doses that I use in my book, you don't make a change, but every maybe 2 years, you'll adjust the dose a little bit. So congratulations, keep going, and the hard part is once they just start improving is sitting tight and just waiting and letting that happen. A couple more questions we got here. One from Ryan. Do you have any info on widespread neuropathy following COVID and what to do about it? So neuropathy is a term that just means your nerve is sick. It's not working right, okay? Now, what happens with COVID is you have a very high inflammatory surge with COVID that can damage tissue, just like a concussion can. And then if you develop leaky gut, the COVID leaky gut, even after COVID's out of the system, the COVID leaky gut will cause this high level of inflammation to remain. And that can damage your nerves. And in particular, a very common thing is called small fiber neuropathy. And it tends to present as numbness, burning, pain. It can start from the feet and work its way up, or it can kind of be a whole body kind of neuropathy, all right? Now, fortunately, as I've talked about with the brain, being able to recover your peripheral nerves, and peripheral means outside of the central nervous system, so basically your arms and legs and chest, torso, those nerves are able to recover also if you get the inflammation down. Okay, so that's what our protocol does. So if you're having neuropathy post-COVID, you look at the doses in the book. You want the high DHA fish oil. You want the olive oil. You want to balance your intestinal tract. In adults, it works best with rifaximin. And routinely now, whether there is a discrete relationship with COVID or just anything in this range of the last couple of years being started, I treat everybody with 6 weeks of glutamine to make sure you don't have any COVID leaky gut. And in the vast majority of patients, that the neuropathy will recover. Sometimes you might need a vagus nerve stimulator. And we have the Vitality Smart Cable. That's 5 minutes a day. That helps to lower inflammation also. But you have a very good chance of that reversing if you can just get your inflammation down. Next is 4-CoM-C. What's the purpose of L-glutamine on the protocol? Well, as I alluded to just previously, pre-COVID, we had no purpose for glutamine. Okay, it's just that COVID is causing, due to its very high levels of inflammation in the body, it's causing a relative deficiency of glutamine within the body. And glutamine is an amino acid that you get from eating protein. But you won't have enough. And you have this deficiency in the body, and it results in cells that line the intestinal tract actually dying and leaving big gaps and causing basically hyperpermeability, which means hyperleaky gut, and sustained high levels of inflammation. Now, fortunately, my background, I'm an HIV specialist, and we use glutamine. HIV does the same thing. We used a lot of glutamine back in the 90s to help fix the gut and inflammatory problems in patients with HIV disease before we had drug therapy. Actually, it's very uncommon now if patients are controlled on HIV. So that's what it's for. Typically, you only need 6 weeks. Some patients feel better by taking it longer, and it's very safe to do. All right. And I have a lot of other videos on YouTube about that. And finally, from XYZ, that's really not their name. I couldn't find their name after I copied this question. But they were asking, what's the time frame for adults, autistic individuals, when you treat, for when they start seeing noticeable improvements? And was more than 4,500 milligrams of omega-3s ever needed? I have another older adult I saw yesterday who started the protocol. They're 29. Started the protocol in February. Intense rage. 10 to 20 rage events a day that often were accompanied by some physical, like violence or scratching or attempted biting. This is a 29-year-old, okay? And within a few months, there was starting the protocol, and that was fish oil, olive oil, vagal stimulator, continuous rifaximin, and glutamine, okay? Because the raging actually started about 5 years ago after COVID hit. And so after starting the protocol, within just a couple months, dramatic reduction. Now, I just saw him recently, so it's been about 8 months on the protocol. The rage events are almost completely gone. It's more kind of irritability. There are far fewer events. The young man is happier, is starting to communicate more, and so forth. So fairly quickly, from an extremely intense, this person was on multiple drugs and agents to suppress their behavior, and they're off almost all of those now. So it can be fairly quickly, and this is coming out on Saturday, just this week, in the we can review where I go over cases. I go over 2 other, one's 20, one's 24, and the success we're having and how quickly they're starting to respond. So if you can get the inflammation down, they respond fairly quickly. All right, that's all for now. Everybody, don't forget to hit subscribe for me, and take care of your kids, take care of yourself, keep your inflammation down, and we'll see you next week.